Listen, you
So
come to
my name is Danielle Jackson. I am the advocacy and outreach coordinator. I'm actually temporary currently, but I am been doing the ICANN program for a couple of years. So I am going to go over this quick little PowerPoint introducing you to ICANN, what we do, what kind of services we offer, and what we can help with. And then Frank Camerata and Patty, I'm going to do it, I'm sorry, Buzinski, I think is the name.
That's good.
Yeah, okay. They are going to come in and do a PowerPoint presentation about the COVID vaccination processes, and it's very interesting. I did enjoy it earlier. So just a couple housekeeping things. I know that everybody seems to be muted, but if you can keep yourself muted to limit the background noise. We'll go through the PowerPoints for anyone who's on a phone and not actually watching. We can give you a copy of the PowerPoints that we present today. So if you registered with the registered for this, we have your email. We can send it out at the conclusion of that. I don't think there's anything else. And if that's that, I will start. Okay, so the introduction to ICANN. So what is ICANN? ICANN stands for the Independent Consumer Advocacy Network. We are the New York State Ombudsman program for people with Medicaid who need long-term care or behavioral health services. We assist New Yorkers with understanding how to enroll in and use managed care plans that cover long-term care or behavioral health services. What do we do? We answer your questions about managed care plans. We give you advice about your plan options. We help you enroll in managed care plans. We help identify and solve problems within your plans. We help people understand their rights. We help you file complaints and grievances if you're upset with what's going on with your plan. And we help you appeal an action you disagree with. I would like to add that these things that we do are all through the Medicaid long-term care services. So if you have an issue with your Medicaid, as long as they're involved with long-term care, which I'll get into what that is, we can help you. But if it's something other than that, generally we refer out to someone else. We help anyone enrolled in Medicaid managed care plan who needs long-term care services, like PCA services, home attendant, adult daycare, nursing home, and behavioral health services, help recovering from and living with mental illness and substance use disorder. The behavioral health services, that would be what people enrolled in these plans, it would be called HARP, the Health and Recovery Plans. Those are generally what they're referring to when I talk about behavioral health. We also help educate people who are newly eligible for enrollment in Medicaid managed care plans. And we can talk to friends and family members, social workers and providers, and anyone else who is helping people with their healthcare decisions. So for example, earlier today, I had a phone call from a nurse who's working with a family. The nurse is from hospice and they're having issues with some of the services that they're supposed to be receiving. She called me as a professional resource and I gave her information to help her serve her client. Who are we? So this page that I'm showing right now lists who we are all over the state. These are all of the agencies that are listed here that work with us. We are the only one in Western New York that really deals with the ICANN program. But if there is somebody who is in the Southern Tier or out, east of us, we will refer out to the appropriate agency that can help you. How we help. So we have trained counselors who answer a toll-free telephone hotline. And once you call, they ask you what county you reside in, and based on your county, they will send you to whoever can help you. We do have different language services. We give educational presentations to consumers, caregivers, and professionals, kind of like this one, except it's all me for an hour-long enthralling presentation. Our services are completely free and confidential. We'll meet you in person at our offices or at your home. Obviously, COVID has kind of put a halt to some of the home visits that we do, but a lot of the things that we would do in person, we can do over the phone on a three-way call, so that doesn't really stop us from being able to help. And we monitor our cases and potential trends and report them to the state. So we serve as you know, a sentinel function as well. Medicaid long-term care services. So what is long-term care? So they identify that health insurance is like Medicare, Medicaid, pays for medical care like doctors, hospitals, and prescriptions. Most health insurance doesn't pay for long-term care, such as personal care services at home, adult daycare, or nursing home. So that's what managed long-term care is supposed to pay for. Many New Yorkers who need long-term care get it through Medicaid, and most people with Medicaid must get their long-term care through a managed care plan. You must join a plan offered by a private health insurance company to get Medicaid to pay for your long-term care. So those are, I say managed care plan, people don't know what you're talking about, but what I tell people is Fidelis, Kalos, Fallon Health, Weinberg, and all of those other, United has one, I believe, or did. So you know, if they have one of those, you enroll into a private health insurance company, and then Medicaid will pay for your PCA. They'll pay for your wheelchair and other long-term services that you may need. Medicaid pays the insurance companies to provide your long-term care services. So if you're having trouble with that, you call us, we help you navigate how to solve that problem. Long-term care services that are covered, home care, including personal care, home health aid, and consumer-directed personal assistance. That is the CD Pass program. That is the program that you hear all the ads on television talking about. You can hire your friends and family to work for you. That's the CD Pass. Adult daycare, private duty nursing, physical, occupational, and speech therapy, transportation to medical appointments, home delivered meals, medical equipment and supplies, hearing aids, and audio aids, eyeglasses and vision, dental care, podiatry, and nursing home. That's not all of them. And this PowerPoint is a little outdated because this stuff is going to be changing in the next coming April, I believe. Some of it, not all of it. So stay tuned because that stands for now, but not forever. A note for people with Medicare. So Medicare is a little more complicated than Medicaid in the whole advocacy world. Filing process is only for people with Medicare and Medicaid dual eligible who want to enroll in MLTC. If you have Medicaid and not Medicare, then generally you do not need to enroll in MLTC. A lot of those services that I just mentioned, you can access some of those services through a regular Medicaid program without Medicare, but Medicare is an additional benefit that some people have depending on their age or disability. So I can help you navigate that if you need it. And you would simply contact your managed care program or HARP plan to request long-term care services. And then that usually starts the process. If you have problems with that process, you give us a call. How do you give us a call? Well, you can call us at the phone number that's listed there. I'll read it out for everybody. 844-614-8800. You can email at that email, ICAN, at cssny.org. However, you're more than welcome to call the agency and ask for the ICAN program. The phone number for the agency, it's a local number, 716-836-0822. My extension is 251. And you can always give me a call, or you can go to the website listed, icannys.org, and then you will have all the information there that you can reach. In regards to COVID-19 vaccinations, the only thing that we want to make very clear is that it's state law that the insurance will pay for the vaccine. Therefore, there should be no cost to you when you receive it, and you should not receive a bill for any COVID-19 vaccination that you get. If you do and you're enrolled in a Medicaid managed care plan or Medicaid, oh my goodness, managed long-term care plan, you can reach out to ICAN for help. So that's when you would give us a call. Even if you have a relative or a family member or a friend or somebody that you help who's having issues with this, or even issues with their Medicaid in general, you can always give me a call. Like I said, I talk to family and friends and professionals, and we always give information about their rights and what they can do to solve their problems. So is there any questions? If not, I think I can hand it over to Frank and Patty. Let me get...
the beginning. Slideshow from the beginning. There we go. Are we on?
You're on.
Okay. Thank you, Danielle.
I'm much more with it this round. So
You're doing great. So I'm Frank Camerata. I am the Executive Director of the Erie County Office for People with Disabilities, and
I'm Patty Ann Gazinski, and I'm with the Office of Public Health Emergency Preparedness.
And we would like to say thank you so much to Western New York Independent Living for giving us this opportunity, especially Danielle and Todd. I know Todd's on the call there. So we just, again, want to say thank you for giving us this opportunity to really get out to the community. I know that this is a very important piece that we want to get out to the community to hopefully provide people with a little more comfort and a lot more information with regard to the vaccine and how the vaccine will be distributed through the points of dispensing. So Patty Ann, I'll let you start.
Hey, good morning, everybody. Even though this is a PowerPoint, we realize that some people may be on the phone, so we will describe for you the pictures on the slides along with the slide content. And we're talking about points of dispensing today. And on the screen, you see a picture of a neon sign that says "Come and get it." And I put that one on there because we want you to come and get your COVID vaccine. And then the picture on the right is a picture from a point of dispensing, which we will talk more about in a few minutes, of the staff and people at that location. Next slide, please.
So what is a pod? A pod is a point of dispensing. POD, P-O-D, is a point of dispensing for vaccines, medications, or other supplies to a large group of people. Other names for a pod are a dispensing clinic, a medication clinic, a dispensing site, and a distribution site. And on this slide, as Patty Ann talked about the last slide, the images that are being portrayed here on this slide, we have a person dispensing pills, medication pills, and we have a person dispensing a syringe or a vaccine to the people. So we wanted to put that vaccine on there because what we'll be distributing and what you hopefully will be receiving in the near future is a vaccine for the coronavirus. Next slide, please.
So when do we activate a point of dispensing? It can be activated for a couple of times. The first time is we would activate one in a natural disaster. Fortunately, that doesn't happen in Western New York a lot, but if you lived somewhere in a flood-prone area, like in the South, you would have pods that might distribute to you after a flood cleanup kit, which is like a bucket and a mop and some bleach. The other type of pod you would have is for an infectious disease outbreak, like hepatitis A, SARS, H1N1, and right now, the COVID virus. Or it might be ramped up for an act of terrorism. For example, if everybody was at the Buffalo Bills Stadium and a terrorist released some anthrax, then we would set up points of dispensing and we would give you antibiotics to everybody who was at the stadium. Next slide, please. Oh, I'm sorry, and the picture is just of some houses flooded up to the roof from Hurricane Katrina.
So there are two types of pods. We have an open pod and we have a closed pod. An open pod is anyone in the public is a pod. An open pod is a pod that anyone in the public can come to. The locations are where public transportation is available, where parking is plentiful, and the building can accommodate staff and public. And the building provides for reasonable accommodations as well. A closed pod is for large employers, hospitals, nursing homes, schools, large houses of worship, jails, prisons, and first responders. But it's also, Patty Ann and I are working with specific populations of people, specifically people who may have an intellectual or developmental disability, or people who may have limited English proficiencies. We're working with local agencies to provide for closed pods. At those closed pods, you're only going to have the people who are receiving those specific services from those specific businesses or agencies. The open pods are open to the public. So initially, we're going to have closed pods, but very soon there'll be open pods that are open to the public, and those you'll be hearing about those hopefully very soon. On this slide, we have a sign that says closed, and we have a sign that says open, just to make everybody aware. Next slide, please.
So how will you know about the pods? How will you know when they're activated? So the County Department of Health, the Erie County Department of Health, or if you're in Niagara County, the Niagara County Department of Health, will let you know when and where the points of dispensing are located. They will let you know the address, the times, and the dates of the point of dispensing. And we will give you that information through using the media on TV. It will be on radio, the Erie County website and Facebook page, and the Erie County Department of Health website and Facebook page. And we'll also have it in printed newspapers. And on this slide, we have a picture of the ways we usually find out information these days. There's a television, a radio, and a computer. Next slide, please.
So who works at an open pod? Open pods will generally include public health personnel like Patty Ann, other first responders, and volunteers such as people who are involved with the Medical Reserve Corps and people who are involved with the Community Emergency Response Teams, or CERT teams. And I think if I could put out a cheap plug, I think Patty Ann is always trying to get people to join our local CERT teams. There are local CERT teams throughout Erie County that if anyone is ever interested, reach out to Patty Ann and she can help you out. We have a picture in the lower right corner of this slide of people who are working at the open pod. And I can tell you that at the open pods, you are going to be greeted by, and you're going to be provided service by people who are providing different services to you as you walk through. I could tell you that Patty Ann works with people with access and functional needs, and she will actually have a specific vest on that indicates the service that she provides. And Patty Ann, what color is your vest?
It's hot pink, like your Barbie doll pink.
So if you're ever at one of the pods for Erie County, look for the woman in the hot pink vest, and that's probably Patty Ann. But then there's other people. You have nursing staff. You have people who are vaccinating. You have greeters. You have all sorts of different people who are working at this pod. So there's a lot of people, and just want to make you aware of that. Next slide, please.
So a couple of things happen when you get to the pod. There are different stations along the way. I always say that visiting a pod is like visiting Disneyland. You get into a line and then you move to the next line and wait. Then you move to the next line. Finally, you get on the ride and then you get to go home. So the first ride at the pod is getting greeted and screened at the door before you even come in. And that's to keep everyone inside healthy. And that's very, very important in COVID times. We do not want anybody coming to a pod if you're feeling ill. If you're in quarantine, if you're in isolation, you should not be coming to a pod. You need to be at home. The next step will be registration. And for COVID vaccine times, you can register online and you might pre-register, or we will pre-register you at the site. And we usually have two separate lines for that. We have a line where people needing a little more time line up, and that's so we can give you some assistance, and we kind of have a fast track line. The next place will be triage or screening. One more time, somebody's going to ask you, how are you feeling today? Again, because we don't want anybody who's ill to be at the pod. And then if answering those questions on the form cues the staff that we might need to get some more medical information from you. At that point, one of our physicians or our nurse practitioners will go over that information with you on the form to make sure that you're a good candidate for the vaccine or the medication. This is a great time to ask questions. Okay, be an informed consumer. If you have any questions at all about the medication or the vaccine or whether or not it's appropriate for you, this medical professional is a great person to ask. And there are no pictures on this slide. Next slide, please.
So part 2 of that, stations at the pod. The next piece you get to is where you're going to be dispensed your medication, or in this case, your vaccine. This is where it's okay to be nervous. As Patty Ann and I have done this training for a few groups, and I can tell you that, and Patty Ann will agree and knows this, but I am somebody who doesn't necessarily like to get shots. I don't like needles, and I know I'm not the only one out there. But it's okay to be nervous. It's all right. It's all right to, just have sweaty palms and not really want to get that shot, but know that it's for the good. But here's an opportunity that you have to just ask more questions. We're there to answer those questions and to assist you. After dispensing of the medications, there's a section. It's for the education. And you're going to be receiving information about the medication or the vaccine that you receive. At that point, we're also going to the pod staff are also going to make sure that you're okay. We're gonna give it about 15 minutes. We just want to make sure that I don't want to say we want to make sure that you don't pass out. We want to make sure that you're not having any side effects from the vaccine. We want to make sure that you're okay to leave. So again, here's another opportunity for you to ask questions. Obviously, there's a theme here. We're trying to be as welcoming and accommodating as possible. We want to make sure that you are understanding everything that you're going through here. So please, if you have people that you're working with at the pod, feel free to ask them questions. They're there to help you out. Remember that. After the education piece, aren't you lucky you get to exit? When you're all finished, you'll leave through a separate door. It's not the same door as when you came in, because we want to make sure that we're keeping everybody separate. So on your way out, good luck.
So I just wanted to go over why we ask you to wait 15 minutes after a vaccine. It's not because we don't think the COVID vaccine is safe. Technically, you're supposed to wait 15 minutes after any vaccine, whether that's a tetanus shot, whether that's your annual flu shot. You really should be observed for 15 minutes. A couple of things could happen in that time frame. People like Frank who are nervous often get through the shot, but then they go sit down on the chair and they realize what just happened and they faint and slide off their chair.
Yep.
So we obviously want to make sure that that doesn't happen while you're driving or being driven home. So we want you to wait for 15 minutes. That's the reason for that. And we'll talk a little bit more about the vaccine safety standards in the next slide. And there are no pictures on this slide. Next slide, please. So the next slide is just a diagram of a bunch of squares explaining what we just did. You'll come in the door, somebody will greet you and triage you at the same time. Or sometimes there's two people, one person greets you and then somebody triages you. Then you'll go for the medical evaluation if we feel it's necessary. You'll go get your vaccine. You'll wait for those 15 minutes. We'll give you some education materials about the vaccine, and then you can exit out. There are two squares also on this slide. One is for the command post, and that's just the administrative area for people running the pod. And then the other square we have is for the pharmacy, and that's obviously where the medications are kept and stored for distribution. Next slide, please.
Where are the pods?
So at this point,
If you can just hold your questions till the end of the presentation, we will get to all
Okay.
of those for you. Okay?
All right.
Thanks.
Thank you.
You're welcome.
so along with the process of going through the pod, we want to make sure that everybody understands what going through a pod will be like. So before you go, we want you to know that pods can be noisy. We will try to have a quiet area for people, but even that quiet area may be a little noisy. There's going to be a lot of bright lights, and there's going to be a lot of people, and there's going to be people asking you questions, and there's going to be people who are going to be giving you vaccines, and so there's going to be a lot going on. But understand and know that, especially during this COVID-19 vaccine, everyone is going to be spaced for your safety reasons. There are also a lot of scents and smells and odors that you may not enjoy. Please be prepared for that. Unfortunately, there isn't a whole lot we could do to because there may be a lot of people there. So just be aware. It may seem rushed to you. If a staff person is rushing you, you can ask them to slow down. It's not a problem. We are human, just like you. We want to make sure that the process that you're going through is as human as possible. The lines are going to be long, but we'll have chairs for people who need them. Again, it goes to the accommodation, the reasonable accommodation piece. If you need a chair, if you need a reasonable accommodation, feel free to ask. It's okay, not a problem. There will be bathrooms. There may be confusion. It may feel overwhelming. It's okay. That's natural for everybody. Please feel free to ask us any questions. Ask us if you have any reasonable accommodations. The point at which you want to ask, though, is as you enter, okay? That's probably the easiest point to reach out and say, hey, I need a reasonable accommodation. And you want to reach out to that person who's in that hot pink vest, Patty Ann, because she's going to be the one who's going to be helping you through this and making sure that you get that reasonable accommodation.
See, what Frank is not aware of yet is that I can take that pink vest off and hand it to him. And Frank might be wearing the hot pink vest to assist you also.
Lucky me.
And the picture on this slide is just of a little grimacing emoji with its fingers in its ears because they are very noisy. Next slide, please. So some other things to know. This slide has a picture of a water bottle on it. Please remember to bring something to drink with you because during COVID, all of the water fountains are closed. So bring some water with you. Also, if you need to take medications or eat at a specific time because you're a diabetic, for example, you need to bring those items with you because you may be there for a while. But if you need some help with your medication, if you need a glass of water, a bottle of water to wash your medicine down with, just ask and somebody will be happy to help you. If you're filling out a form, if you're trying to read some information that you've been given, and if you have some trouble reading, staff will be happy to help you. Okay, there's no judgments here. Maybe you just can't read because the print is just too small to read. Maybe you left your reading glasses at home. Maybe you just don't read very well. That's all okay. If you have trouble reading, staff will always help you. Service animals are always allowed and welcomed at a pod. That would be great. Please know that they need to be service animals. Okay? Bring something to keep you busy during those long lines. If you do word searches, bring a word search book. If you want to, play on your phone, play a game on your phone, but please bring something to keep you busy. And it's always too warm or too cold in a pod, depending on who you are and your body temperature. So please be aware that you might want to dress in layers. And because COVID is a vaccine, please wear a short sleeve shirt that we can easily access your upper arm so that we can give you that shot right in that deltoid muscle. So you might want to wear a sweater over the short sleeve shirt. Next slide, please.
So as Patty Ann and I were developing this this PowerPoint, we had done it with another group, another couple groups. Bless you.
Thank you.
And
Excuse
before we did it, we actually reached out to the group, and they had questions that they asked us. So what we did was we added those questions to this PowerPoint, and all of those questions were really very good. So I'm actually going to let Patty Ann answer this first question. How do I know the vaccine is safe? Because this is a very important question, and I know a lot of you on this call will have that question.
So I think this is an excellent question, and I'm glad that somebody asked us this question. There's a lot of wondering about whether this vaccine is safe or not, because some people feel it was politically motivated to be done at a certain time. Some people don't believe it. Some people are worried because it just got done faster than any other vaccine. So I did a little research, and this is what this vaccine, all of these vaccines had to go through before they could even be given emergency use authorization. So each drug company had to hold 3 trials with volunteers of different ages, with the exception of young children, because we never test a vaccine out on young children first. So the drug company had 3 different trials with the same drug of different ages and ethnicities. You know, drug trials used to only be done by white males, and they found out that, you know, medication is different depending on your ethnicity. It might be different depending on your gender. So these results from these 3 trials are then peer reviewed by other scientists. That means that they have to publish that data, and that data gets reviewed by other scientists, not scientists hired by the drug company, not scientists hired by the government. They are reviewed independently by other scientists. Those other scientists read the peer review, make comments, and have open discussions that are given and shared. And if you went online right now, you could read the peer review of Moderna and the Pfizer vaccine. And I received the Moderna vaccine, and I received it after reading the peer review and was absolutely convinced by what the other independent scientists had said that this was a safe vaccine to take. So after these trials are done and after the peer review is finished, the drug company then seeks emergency use approval. Now, what does emergency use approval mean? It doesn't mean that we're going to approve this drug because it's an emergency and we don't care what happens to the people we give the drug to. That's not true. Emergency use approval means that we're just going to speed up this process a little faster because we have an emergency that we need to take care of. So after the drug company seeks emergency use approval, then another group of independent scientists, again, not hired by the CDC, not hired by the government, review the emergency use request and all of that data again. Okay, so right now you have 2 groups reviewing this data. When this data is then done being reviewed by the scientists this time, then that data goes to the Food and Drug Administration staff and their independent vaccine advisory committee. That independent vaccine advisory committee is not made up of Food and Drug Administration staff. They are independent experts that sit on that committee. When that data gets done being reviewed by the Food and Drug Administration staff and that independent vaccine advisory committee, it goes to another review group, which is the Center for Disease Control. It goes to the CDC advisory group review. And once again, the CDC advisory group review are not members of the CDC. They're not employees of the CDC, and they are not government employees. They are scientists and experts in their fields, and they review it again. Certain states, after that point, may do another review, and those two states are usually California and New York, okay? And after the CDC advisory group review, if all of these independent review panels think that this vaccine is safe, they will grant the emergency use authorization. It does not get approved 1 minute before then. If you're wondering why this vaccine was developed, how did it get developed so quickly? That's never happened before. You're right, it hasn't. And that's because the government helped support development of this vaccine, which it usually doesn't ever do. Okay, and all of the drug manufacturers, because the government helped support the development of this vaccine, that meant that the drug companies had to share their data with each other's companies. And so there was free and open sharing of the data and the processes. And that's one of the reasons why we were able to get this done in under a year. So it really did go under pretty rigorous trials before it even got available to the public. And the picture on this side is just a little yellow diamond that says safety first. Next slide, please.
So just like with anything in life, there are risks. Everything we do, when you're walking outside, when you're driving, when you're eating, whatever it is, there are always inherent risks in life. The medications that we take, the vitamins that we take. So, when you're taking an ibuprofen or whatever it is that you're taking, there are certain risks that you're taking when you're taking these in. So that's something to keep in mind as we consider the COVID-19 vaccine. You may have a slight reaction to this vaccine. Patty Ann has had it. Patty Ann, how was your reaction?
My reaction is pretty much the same as any vaccine that I've gotten. It feels like a tetanus shot. My arm is a little sore. Last night, the site of the vaccine was a little red. There was a little bit of swelling, but it's the soreness is going away. So I would say that this doesn't feel different than any other vaccine I've had, and certainly a lot less painful than some other ones that I've had.
It's like the flu shot. You know, when I had the flu shot, I'm sure when you had the flu shot, you know, generally you do have some arm soreness and some stiffness in your arm. And generally when I get the flu shot, I just pop an ibuprofen and the next day I'm all set. So, but the thing to do, the important thing and the most important person you want to talk to is your doctor or your medical care team. You want to talk to them about the possible inherent risks that you're taking when you're asking for this vaccine. Next slide, please.
So where do you find some good information sources? So we want you to be careful where you get your information. Just because it's on the internet doesn't mean it's true. Just because it's on the news doesn't mean it's true. There's lots of information out there. So we want you to use trustworthy websites. This slide has a picture of a traffic light with the green on top, yellow in the middle, red on the bottom, light signals. So the green light are good sources of information. And those are usually information that comes from a university site, colleges, reputable education places, and they usually end with a .edu. Like if you went to the Children's Hospital of Philadelphia, you know, it's CHOP at .edu, I believe. Okay, those are great sources of information. There are independent government web pages that have the .gov at the end of it. For example, it's Erie County Department of Health.gov. It's the Office for Persons with Disabilities at Erie.gov.
Right.
Okay, those are good sources of information. The next sources, you kind of got to use caution when you look at them. And these are non-governmental organization pages, and they usually end with .org. But that doesn't mean that they're not a good site. It just means you need to be careful with that. And those are sites that are usually magazines, newspapers, and media. And how do you know if what you're reading in the media is true? A good rule of thumb is to look for that same information from different sources. Are they all saying the same thing? You know, for example, what does CNN say about this? What does Fox say about it? What does NBC? What does CBS? What does the BBC say about these things? Always, always, always go to more than one source. And then there are some red sites that you really should distrust. One of those is Wikipedia, and not because I don't like Wikipedia, but you know, the people writing Wikipedia are not the people who used to write the Encyclopedia Britannica, if you're as old as I am. You or I could go right online right now and place an entry into Wikipedia. So please be careful of that. People's blogs. You need to know that all of us have a bias, so nobody's blog is completely unbiased. So please be careful with blogs, and please don't trust anybody who got their doctor's certificate from social media. Okay, there is no Google University of Medicine. Please be careful. There are some very trustworthy websites when it comes to medical things. That's the CDC, the Center for Disease Control.gov. That's an easy one to remember. The National Institute of Health is a good one. And people always say to me, well, you know what, I don't want to go to the CDC because they only give me information about standard medical things. They don't ever tell me about alternative medicine things. Well, that's not really true. If you want to know more about alternative medicine, when it comes to dealing with Western medicine, then you go to the National Institute of Health. They have an entire division dedicated to alternative medicine. There are famous medical schools, the Johns Hopkins Medical School, University of Pittsburgh, right here in our own backyard, the University of Buffalo Medical School. Medical schools are great sources of information. Cornell, all of those are great sources. And of course, you always have your local Department of Health, either the New York State Department of Health or your local Department of Health. You can always call us up and ask questions if you can't find it on our website. Next slide, please. So this is just a quick recap. University sites that end in edu are good sources of information. .gov are good sources of information. .org and media, those are kind of questionable in the yellow. Do your research, check those against each other and see what they're saying. And then people's Wikipedia, their vlogs, their blogs, Dr. Facebook, all of those people need to be taken with a little grain of salt. Actually make that a whole salt shaker. So be careful. Next slide, please.
So the next question we have that was asked of us is, who will get this vaccine first? As you may or may not be aware, Erie County is actually in the process of providing the vaccine at this time. We were provided guidelines through New York State Department of Health. New York State Department of Health created local regional hubs, and the local regional hub that Erie County is part of is headed by Catholic Health and ECMC. So at this time, Catholic Health and ECMC, who are leading the hub, are responsible for distribution and dispensing of the vaccine. The CDC, along with Department of Health, will decide who gets that vaccine first. And right now, that has already been decided. As you may or may not be aware, there are specific stages. Right now, we are in stage 1A, and stage 1A is for first responders, people who are in the OPWDD system, the OMH system, as well as the OASIS system. We are also working with people who are in nursing homes, and doctors and nurses, etc. So this is continuing. The number of people who are getting the medications through through Catholic Health and ECMC continues to increase. Erie County Erie County Department of Health is actually just starting to distribute medications. As the slide says, first round will most likely go to elderly and healthcare workers. That's exactly what is happening. The groups are selected by the risk that they face. That's exactly how the New York State Department of Health has determined how to get that vaccine and how to distribute that vaccine. The people who are at the most highest risk. The higher your risk, the faster you're going to get that vaccine. Remember, there are a lot of doses that have to be made. Keep this in mind. Erie County has a population of over 930,000 people. So what that means is we need to make sure that 930,000 people, if they want that vaccine, they need to get that vaccine. And in most cases, these vaccines are requiring 2 doses. So that means almost 1.8 million doses of vaccine have to be dispensed. I know that everyone is anxious to get this vaccine. Please, all we ask is please be patient. It's coming. We are working as quickly as we can. We can only work, though, as fast as we get this vaccine. But I can tell you that Erie County, as fast as we're getting this vaccine, we are getting this vaccine out. So next slide, please.
And I just wanted to focus on something that Frank just said. Please remember that just because you have a disability doesn't mean that you get the vaccine first. For example, if your disability is that you're deaf or hard of hearing, or you're blind, or that you use a wheelchair and you don't have an underlying medical condition that puts you at risk, you may not be first on the line for that vaccine. When we come to decide the elderly group, when the CDC and the State Department of Health look at it, okay, obviously seniors that have underlying medical conditions will get that faster than healthier seniors were. So it all goes by the risk that you face.
And keep in mind that, you know, those numbers that New York State Department of Health used to create those lists, you know, unfortunately, that's from the number of people who passed away. The highest number of people who passed away from this COVID-19 are people who are seniors. People who are over the age of 70 have been at much higher risk. People who have disabilities are in a much higher risk category. So New York State Department of Health has viewed that, and that's why those people are in that first category, as well as the doctors and nurses and first responders who are responsible for providing that care.
And please remember that we're not just making a lot of doses of vaccine. We also have to make the glass vials to hold the vaccine, the metal top on the glass vial, the plastic top on the metal vial that keeps it sterile. We have to make the syringes, we have to make the needles, we have to make the gloves, the masks, the PPE. All of those things have to be produced. So that's one of the reasons why it's taking a while to get it out, along with creating a new vaccine that we've never created before. So it's going to take a little time. Next slide, please. Oh, the picture on this slide is one Frank does not like because it's somebody getting an injection. Next slide, please.
Oh,
So the third question, this is you, right?
Okay, so the third question is, do I have to get the vaccine? And the answer is, it's always your choice. It's your body. You decide whether or not you're going to get that vaccine. Who is the best person to help you with that decision? It's not the Department of Health. It's not Frank. It's not myself. You need to speak with your doctor and your healthcare team and your medical providers. They know you, they know your medical history, and together they can help you make the best decision to get this vaccine. We're trying to get as many people vaccinated as possible so we can build up to that herd immunity that you've heard so many people talk about. So we're looking at about 70 to 75% of everybody in the US. So that means that we are still going to be, for quite a bit, wearing our masks, keeping social distancing, washing our hands, all of those good things. Once you get the vaccine, it doesn't mean that you are immune. I got my shot almost 36 hours ago. I have a second shot. And any immunity that you get from that second shot doesn't come in till almost 2 weeks after that second shot. So you need to be very careful with it. So it's your decision. You decide, speak with your doctor and your healthcare team to make the best decision for you. And the picture on the slide is just you decide. Next slide, please, Frank.
So the next slide is, will my agency give me the vaccine? New York State Department of Health and county health departments are working with agencies and other community providers and groups to make the vaccine available. I could tell you that for the past couple of months, Patty Ann and myself have been working with the local agencies. As I mentioned, I mentioned the people with limited English proficiency. We've worked with those groups. We've also worked with people in the disability community, the intellectual developmental disabilities community, and we continue to work with them to create the closed pods, which we discussed before. So it's very possible that New York State Department of Health will ask your specific agency to provide that vaccine to you. It's very possible, but in the event that they're not, it may also come from the local county Department of Health. So right now, we're still working on it. Again, we're still in the very early stages of dispensing this vaccine. Next slide, please.
And the picture is somebody getting a vaccine that doesn't look any happier than Frank looks when he gets one, probably. Next. So how will you know when it's available? Well, the vaccine will come in waves because production will be in waves, right? We'll give everybody their shots, then we have to wait for it. Then all of a sudden, here it is and it comes. So until the manufacturing becomes more steady, it'll be that little wave thing. We will let you know when it's available using those resources that we mentioned before: television, radio, your agency, on a computer website. You can also visit the county website or Facebook page, or the County Department of Health website, or more information. And that is where the pod locations will be advertised. Somebody had asked where the pods are. I can tell you that I do not even know where the next couple of pods are going to be for the next group of people other than first responders, because it just depends on the group. I can tell you that we will move them around the county so that everybody gets the chance to go to a pod. We are working with NFTA to help make transportation available. We will do our best to be fair and equitable in where the pod locations are. Next slide, please. And there's no picture on this slide. Next slide.
So who do I speak to make sure it is safe for me? This is another really great question. Again, this is why we put these questions on there. I think that these questions are questions that you are all thinking about asking, but they've been asked before, and that's why we put them on these slides. The best person to talk with about the safety of any medication or vaccine is your doctor or your medical care team. They're the ones that know your condition, your history, and the potential risks that you may face. So reach out, talk to your personal physician, talk to the care team that you work with, and ask them the question. Ask them about this vaccine. Ask them the thoughts about this vaccine. And if they say it's a great idea, which I'm sure that they will, get that vaccine. Next slide, please. Oh, uh-oh. Oh,
Hi, sorry, I got kicked out. Hold on, I'll go back.
okay. Oh, did we time out?
I don't know what happened, but I'm back and we're all
there
good.
we go.
There you go.
All right. We're almost done.
Thank you, I'm sorry.
It's okay.
So
So the next slide. All right, so the next slide shows a woman sitting at her computer and she's got her hands on either side of her head. She's looking very exasperated. So I titled this slide, "It's Frustrating." You know, it's been a very frustrating year for all of us. It's okay to be scared. It's okay to be confused. You know, one week you hear this, the next week you hear something that totally contradicts what the experts told you the week before. I know that that's very confusing, but that's because this is a new virus and we are learning more about it as we go along. And when we learn ways to prevent it more effectively and treat people better, then the recommendations changed. But that can get confusing and we appreciate that. You know, it's okay to be skeptical, but don't let your skepticism go unchecked. Find out the answers you want. Go to those reputable sources to find the answers to your questions. It's okay to ask those questions. Okay, and once again, it's okay to be frustrated. A lot of things are unknown and things are really, really moving fast. Speak to your healthcare team and other people you trust to give you the best information. So if you're scared or confused, frustrated, those are very normal reactions to a very abnormal situation that we're in. Next slide, please.
So here we are at our last slide. Here's your opportunity to ask us any questions that you may have. But before we do that, I just want to give you our contact information. Again, I'm Frank Camerata, and if you want to reach me, you can call me at 858-6233.
And I'm Patty Ann Gazinski, and you can give me a call at 858-7109.
And if we don't know the answer to your question, we will certainly find somebody who does know the answer to that question. Is there anybody on the call who has any questions?
Yes, Linda.
Hi, Linda.
I have about 3 or 4 questions for you.
All right, well, Linda, let's take one at a time.
The first thing is, when you're talking about nursing homes, I know that there's a lot of nursing homes, but nobody has said anything about assisted living facilities. Are they considered nursing homes?
Yes, they're all in the same group. That's considered congregate living. And so assisted living, group homes. For example, we have some sisters. We have some group of nuns that live in infirmaries in their convent. That group is considered congregate assisted living. Yes, they are all on the radar. Good question.
Okay. I didn't know because nobody has said anything. I didn't know what they were talking about. The second thing is, when you go to these pods, say, you're going to go to a pod and get a vaccine, do you need to make an appointment?
Yes, you do. If you go to the Erie County website right now and you click on
I don't have a computer.
All right. Then
is there a phone number, when it comes up, is there a phone number that people can call?
Yes, 858-2929. Okay, and if you fall into that category, and they can review that for you, okay? We can help get you registered. We can help get you an appointment and get you registered. But right now, I can tell you that it's still the top of the first tier. It's first responders, people who are doing direct medical care, and people that live in those congregate housing situations.
With OPWDD.
Okay, well, I understand that. Yeah. The third question is, can you bring somebody with you to that can drive you to the pod?
Absolutely. However, let me warn you that just because somebody drove you doesn't mean that this person's going to say, well, can I get my shot while I'm here too? Normally if it were a flu clinic, we would say, absolutely, come on. We like to give vaccinations. But this time, if your driver doesn't fall into one of those categories that's being vaccinated at that time, they will need to make a separate appointment.
It is considered a qualification.
Okay. Now, the next question is, if you're taking public transportation like paratransit, how do you schedule your drop-off and pickup times?
Linda, that may be difficult. We are working with NFTA. As we try to determine where we are going to put the pods, the points of dispensing, we're working with NFTA.
Right.
So I mean, it is going to be, it's going to be something that, the paratransit user, when
Right.
you make that appointment, I would certainly make that appointment for at least 2 hours.
Okay.
Okay, Linda?
Yeah.
Okay, great. Do we have anyone else who has questions?
Yes.
Hi, who are we speaking with?
Mary Ann,
Hi, Marianne.
I'm 85, and I have a handicapped boy who's 58 and lives with me. Do I go into a special category?
What, if we may ask, what is your son's disability?
He's Down syndrome.
Okay, so right now, your son qualifies. Okay?
Okay.
She may also.
You may,
And then I have high blood pressure.
You know what, Marianne? When you go online to register to get an appointment,
Okay, I'll
They-
have to call because I don't go on, I haven't got a computer.
okay, they will ask you all of these questions. Okay, they will ask you
Okay.
some questions, and that will let you know whether or not you're qualified yet. It will not let you make an appointment if you don't qualify for an appointment at this time.
Okay, but I could call and inquire about my son then.
yes.
Okay, great. Yeah, because he's prone to pneumonia,
Sure.
so we're kind of cautious with everything.
And that, you know what, and that's the
Okay,
best way
that
to
would
be.
be the Erie County Health
Eight-
8582929 number.
Yes, and ask them what the process is to register if you don't have a computer.
Okay, great. Well, I
Excellent.
appreciate your help.
You're welcome. We appreciate you being here. Any other questions?
No, I think that's all I had for that one.
Right. Anybody else?
Well, I just have a comment.
Sure.
I appreciate all you folks are doing.
Well, thank you
because
very
this is
much.
great information for us.
Thank you,
Thank you.
Marianne.
Thank you very much.
You're
Thank you.
very welcome.
God
And
bless
we
you.
appreciate your wearing a mask and washing your hands and keeping your
Oh, yes.
distance. I cannot
Oh, yes.
tell you, we could open up 20 pods and vaccinate thousands of people every day. But if people don't do those simple things like keeping social distance, you know what? And I don't like the term social distance. Let's say physical distance, because we can all still be socially connected. We can talk to each other on the
Yeah,
phone.
you can.
Right? We can do all kinds of things. But if you keep your physical distance, if you wash those hands, and please wear that mask and only go out when you need to go out, that is the biggest help. You guys really are the heroes in this. We need your help. We can't do it without you. So thank you very much for appreciation. It's always nice.
And if you have to grocery shop and go at 6 a.m. when they open the doors.
Yeah, you know what? That's what I do too. And then I run to work and throw my milk into the cooler at work. So next person, do we have any other questions from anybody else?
Hello, can you hear me? This is Juice.
Sure
Hi,
can, Juice.
Okay, hi. So my question is, there was a consumer that contacted me in regards to, do they have to get vaccinated should they get tested for the antibiotic before they get vaccinated? And does that matter at all in this process?
No, what matters in this process is if somebody's asking that question, that's going to bring up some red flags. Are they feeling sick? Okay, if you're feeling sick, absolutely do not make an appointment because it's not the right time. If you are in isolation, if you are in quarantine or just finished being in isolation, we are going to ask you to wait, because you need to wait like 90 days, because we believe that right now there's some residual immunity that will give us time to get everybody else vaccinated that doesn't have any immunity.
Okay, So
Great
there's a
question.
wait period after the either being around someone and or getting it before you even schedule or discuss the vaccination.
If you are in isolation, definitely not, because I for isolation means you're ill, right? So if the Department of Health have said you need to isolate, that means that you've got a positive result from a test. That means you need to be home. If we've asked you to quarantine because you've been near somebody, that means that we just want to be sure that you don't get sick. So if you break quarantine, while you might feel well, you could well be spreading COVID to other people. And the Department of Health will not be very happy if you break quarantine to come to a point of dispensing.
Okay, thank you.
You're welcome.
Be good, Juice.
Thanks.
Other questions?
Anybody else?
All right.
Well, you have our numbers, and Danielle and Todd certainly know how to reach us. If you have any other questions, please feel free to contact us. We are here to help. Please remember, continue to wear your masks, continue to physically distant. Please wash your hands a lot. And if you don't have to go out, please don't. Okay? And you'll hear from Erie County, you'll hear from the media sources when it's your turn to get that vaccine. Until then, be safe, everyone. Thank you very much.
Have a
Thank
good
you. Have a
Thank
good
you.
day.
call, everyone.
Thank you. Be well and safe.
Stay safe. God bless you for your help. Bye-bye.
Thank you for your help, folks. Appreciate your.
Bye, Danielle. Bye, Todd.
We like
Bye-bye.
technical